So good morning to everyone. First want to say that I'm very pleased to be here to talk about a European experience in tomosynthesis and contrast-enhanced spectral mammography, so the advanced applications in mammography. So I will do a presentation in two parts. I will first talk about tomosynthesis and then a few illustrated cases of contrast-enhanced spectral mammography. So the question today is, will tomosynthesis be the future modality in mammography screening? So before answering or trying to answer, here is a few figures about cancer, mammography cancer in breast cancer in Europe. So it is, in terms of occurrence, the first cancer in Europe. It represents about 30% of the new cancer cases for women. And this is an extract of the European guidelines that advise to put in place screening programs for women between 50 and 69 years of age and to do screening examination every 2 years. There is now evidence that these screening programs that have been put in place help to reduce the mortality due to breast cancer up to 35%. This is here a map representing the uptake rate of the screening programs in different countries in Europe. We see that there is a lot of differences between these countries. I mean, the uptake goes to 50 up to 80% of the population. But that's overall about 2/3 of these countries have implemented a screening program. The gold standard for the screening program is 2D mammography. But we know that there are some limitations to 2D mammography that will be explained in the following presentations. And one way to reduce the problems due to 2D mammography is, or could be, tomosynthesis. So there are numerous studies in Europe that are looking at the question, is tomosynthesis a performance modality to do screening? And I will just cite here 4 examples of large population-based studies, so studies that will look at the performance of tomosynthesis in screening, sponsored or not sponsored by different vendors. We have one study very well known in Oslo, one in Malmö, one in Reggio Emilia in Italy, and the second one, the STORM study in Italy as well. All these studies, and you will see the results in other presentations today, have proved to increase the cancer detection rate while keeping or lowering the recall rate for the exams. So all these studies have positive results. Here is another way of looking at the results. So it's a very well-known study. It's called the JAMA study. So overall, I mean, in total, I think, it's more than 4,000 exams that are represented in these studies. So on the graph on the right, each line corresponds to one center that has implemented DDT in addition to FFDM. On the 2 axes of the graph, you've got on the x-axis the recall rate, and on the y-axis the cancer detection rate. Each line has 2 dots, one white dot and one dark dot. The white dot here represents the performance of the center before the implementation of DDT, and the black dot, performance of the same center after the implementation of DDT. And we see that overall, in average, the centers are reducing the recall rate and increasing the cancer detection rate. So overall, the performance of DDT is increasing the performance of screening in these centers. I mean, a difference that is important to note is that this study is a retrospective study done in the US, so the practice is a bit different than the study that I presented before in Europe, where the recall rates are already very low. So what are we looking at when we look at the tomosynthesis exam? We look at the 3D data set, which is here represented by planes. But I mean, it's easy to see that looking at 100 images instead of one will likely to increase a lot the reading time. This is why there are two other possibilities. The second one is to look at thick planes or slabs that represents 1 centimeter of volume. Or another possibility, also important to compare to priors, if the priors were done in 2D, is what we call the 2D synthesized view, or here. So different vendors will call the synthesized view differently. At GE, we call it V-preview, for example. Another tool that comes in addition to that is what we call enhanced V-preview. So enhanced V-preview will add information in the V-preview to help you guide you in the reading of the volume. An example maybe to illustrate that. Here, so on the right is the V-preview, in the middle is the thick slabs, and on the left are the planes. So on this case, you could see that the lesion is enhanced on the synthesized 2D, very visible on the slabs, as it is visible on the planes. So a couple of examples to show how can tomosynthesis help in the day-to-day practice. So this first clinical case is a 60-year-old woman that felt a lump in her upper quadrants of her right breast. So she had 2D, DBT, and ultrasound, and we'll look at the different exams. So here is the 2D exam. We can see that there is a kind of focal asymmetry on the right breast, and opacity on the left breast that is difficult to see on the CC as well. So let's look at what 3D is showing us. So in the middle, we have the synthetic view with the 3D CAD on and off. The 3D CAD is showing us one lesion, so we click on it and we'll see it in the volumes on the right breast here. And looking at the left breast, nothing in particular. We can look at as well on what's going on in CC. So here in CC, with the CAD on and off, and we see that there is some focal asymmetry here on the internal quadrants of the right breast, visible in the planes and in the V-preview. So here a case to illustrate the fact that the lesion was more easily detected in 3D than what it was in 2D. But if we look at the results of the studies, I mean, the cancer detection rate is varies from 3 per 1,000 to 8 per 1,000. So to detect a case in tomosynthesis that you wouldn't have detected in 2D, you need to look at 1,000 cases. So this is not something that happens every day. A close-up on the previous case, on the asymmetry, and it happened to be a radial scar. So the lump that she felt was found here, and this is the radial scar, oops, that was visible. So back to what I was saying, so this is an example of a case that was not detected in 2D but detected in 3D, but this is not what happens the most frequently. Most frequently is that it helps you clear up cases where we could have doubts. One example here. This is the 2D mammogram of a lady coming for a second screening exam. And well, here there's clearly a symmetry in density that will catch your eye. It's difficult to say where it is in the CC view, probably here in the external quadrants. But if we now look at DVT, so again, the previews in the center and the volumes on the side, we will clearly see that on the left breast, scrolling through the volume, that it was tissue superimposition. So no need to recall that patient, no need for biopsy. A third case in tomosynthesis. So 64 years old woman, high risk. And here's the 2D exam. So not very easy to read. I mean, heterogeneous densities. Some asymmetry here that maybe catches your eye, but difficult to say. Here is what we see in DVT. In the center, the V previews, enhanced by the CAD here. And we see that, I don't know how it shows on the screen, yes? There's a small speculated mass that here, a close-up, maybe we see better. So 2D on the left, the V preview enhanced by the CAD, and the DVT planes on the right. So clearly this lesion was easier depicted in DVT. Here's the ultrasound. So it was found back on second look ultrasound. It was a small lesion and happened to be invasive ductal carcinoma grade 2. So here, with these few cases, I wanted to illustrate the fact that it helps increase sensitivity, so the ability to detect cancer cases, and specificity, so meaning it helps to clear out cases that are not cancers. So so transitioning to another advanced application in mammography, contrast-enhanced spectral mammography, and its use in Europe. So this is contrast-enhanced spectral mammography. So this is a technology that was developed during the years 2000. It was first commercially released in 2010, and we have today about 400 users in the world that are using CSM. So what it does is, just like in MRI, it detects angiogenesis around the lesions. So after injection of contrast agent, two acquisitions are done at different energies, and the two images are recombined to give a map of the iodine uptake. Here is so what I've just explained. What we are detecting is the angiogenesis. So what I think is more important is to compare what is CSM doing versus mammography alone. So we have now more than 100 publications looking at the performance of CSM. I will just quote 3 of them that were done in 2016, so latest one. The first one in a French center, French oncology center, showed that CSM could be easily performed in daily practice. So in addition of the fact that it brings additional information, it's easy to use. That's the result of this study. Another study done in the UK by Dr. Tennant shows that CSM provides immediately available and clinical useful information, and this for symptomatic patients. And another one done in the Netherlands by Dr. Lutji, the same team like Dr. Lobes that you may know, that have done a lot of work on CSM, and says that it is superior to mammography alone, especially for problem solving, so when we have questions, and that not enough information is given by mammography. So overall, these 3 studies and many others show that CSM is superior to mammography alone. Now, what's even more important and more interesting is to compare the performance of CSM to breast MRI. Here again, just a sample of the studies that were done for CSM. So here the first one, done by Dr. Lee, show that CSM has the same sensitivity and higher specificity than MRI. It was done on a small cohort of 66 patients with sensitivity here of 100%. It's a small cohort. And two other studies here that were done comparing the performance of CSM and MRI. And these studies show the same performance in terms of sensitivity than MRI and slightly better specificity in the studies, about 5%. So it's a small increase, but still higher than breast MRI. All these works, so more than 100 studies done on CSM, have convinced the European Society of Breast Imaging that CSM could be a right alternative to breast MRI. So to illustrate that, I wanted to show you a few cases in different setups. So one in screening of difficult cases, one in case solving, one in treatment monitoring. So if we look at the first one, at the screening setting, so a 48-year-old woman. I don't know if you recognize this case. It was the case of my introduction. So very dense breast, very difficult to read. Well, she felt actually one lump, but that is completely invisible in 2D. And here is what CSM exam is showing. So a very rounded shape with not that regular borders. That was proven to be, so found back on ultrasound. So we see here the lobulated mass, dark center, to be invasive ductal carcinoma. Here, cancer staging. So cancers with a very suspicious lesion. Before deciding for the treatment and doing the biopsy, sometimes we do an MRI to see the extension of the cancer. So here, there is a clearly visible mass. Well, the microcalcifications are not visible on the screen, but here there are some microcalcifications. And after CSM, what happens to be a multifocal lesion in the left breast that was not, that was not easily visible in the 2D. In case solving, sometimes we use MRI for a case that we don't know what to do with, so to have more information. Here is a 2D exam of a woman with a lot of dystrophic microcalcifications in the left breast, and nothing was found at ultrasound and even second look ultrasound. So she was sent to CSM, and here is the CSM result. So a very big uptake on the left breast, and this was not visible on any other modality. And it happened to be neuroendocrine cancer of more than 10 centimeters, so very, very large lesion. And I also wanted to show you, so this is research work from Dr. Yoti in Reggio Emilia province. And she is currently studying the possibility of using CSM for monitoring chemotherapies. So here we have a 69-year-old woman with an ILC of 43 millimeters. And we will look at images at different steps in the treatment. So on the left, before treatment, so very big uptake, a few centimeters. Below we have the MRI uptake here. In the middle it is during the neoadjuvant chemotherapy here, so uptake and visible in MRI, and after the neoadjuvant chemotherapy, no contrast uptake in the tumor bed. So here are a variety of examples where CSM was used and an illustration of those cases. So I would like to thank you very much for your attention.
Could you explain please the method of CSM? How in which minute we want to, in which minute we should check the images and so on.
Okay, so well, first I have to say that as part of the company, I cannot say where and where not to use. But what I can say is that anywhere where MRI is useful, CSM can be useful. So any patient that you would have sent to MRI is a potential patient that you could send to CSM.
No, the technique methodic.
Okay, sorry. So it's the same, so there is a contrast injection. It's the same contrast agent that we use for CT. So we use it at same concentration and same rate. And then it happens like a mammography exam. So you just set up the machine to do CSM, and you do your normal mammography examination. So 2 views per breast, CC and MLO, and you don't realize it, but instead of taking 1 image, the system will take 2 images at the same time, 1 low energy and 1 high energy, and will recombine these 2 images to provide you the CSM image. So it happens just like a mammography exam. You just have to inject your patient with iodine, contrast media beforehand, and wait 2 minutes for the perfusion.
Когда аденозная железа, и только при ССМ видим образование, копии 0,4 мм, на УЗИ не видим, под чем колоть, как найти его?
It's a very, very good question. Thank you. Today, there is no possibility of doing CSM guided biopsy. So the alternative today is to do MRI guided biopsy. In the future, we do not exclude to provide a system that will be able to do biopsy with this, but it is not the case today.